Hi, I'm Dr. Dan, and today we're going to discuss supplementation and blood testing. Now, what you're looking for is to feel good, take supplements that actually work for you, and not spend your life savings and trying to keep these supplements stocked up in your pantry. And I've seen people come to my office with a whole shopping bag full of supplements. They want to know which ones of these are really helpful. And sometimes you can tell something by muscle testing and other things, but tell you the truth, over the years I've gotten to rely very heavily on blood testing, because blood testing is an objective third party who gives us some nice numbers to look at about what your body's actually going through. Now, I should also mention that there are two ranges on these blood tests. There's what we call a functional range, and that's an ideal healthy range, and then there's a pathology range. And we like to see you in what we call the functional range. That means that these markers are in the healthy category and not just barely hanging out of the pathology range. So when we look at this, we also want to get an idea of the hierarchy, because if you have 3 or 4 things going on, how do you know where to start? And with the blood test, it's pretty easy, because we can find certain things that we know are going to affect your entire health, and if we don't correct those, maybe a chronic infection or a high iron or something, and if we don't get that under control, nothing else we do is really going to make much difference. So with this blood testing, we can get you some very specific recommendations much more quickly, and we don't have to, say, use a shotgun approach and use just every supplement on the shelf to try to make you feel better, but we can specifically target 1 or 2 or 3 that really should make a difference, and then we retest in a couple months, and those we should see a nice change for you. So that's why we do blood testing. We found it to be extremely reliable, and once we learned how to do this, and it took some time, but once we learned how to do this, there was really no going back. So that's why we use blood testing and supplementation. Now, also I should mention that the cost of this is much less than the usual doctor's visit. We can get the cash price in California and Nevada through Quest Labs for under $150, and for other states we use direct labs, and that's still in similar price range. So it's very reasonable from that standpoint, much cheaper than wasting supplements. So that's why we do that, and we've had great success, and we hope this little talk was helpful. Thank you very much.